Thanks for being here. I mean, this is really nice, and I know we had our opening session, and they talked a lot about bears, and thank God we don't have to worry about any bears in here tonight. This is, it couldn't be more timely when you think about it. I mean, tomorrow's decision and what this means for so many of us, really, when it comes to policy and when we think about our own personal lives, how we talk and how we treat each other, and how we think about taking care of our communities. And so this is something that 9 folks wearing black robes are going to determine our fate and have the final word on this. And so it's something that's very meaningful and dear to all of us. With us today, John Klein of Time Magazine and Ron Brownstein of the Los Angeles Times and National Journal. Both of these journalists are absolutely excellent and professional and very distinguished in the field of healthcare. I want to talk a little bit about what's at stake here. When we look at tomorrow's decision, we think about public policy, but we also think about our own lives. I can think of my own family for myself. My mother is battling with Lou Gehrig's disease, ALS, battling for her life. And my father is fighting prostate cancer. And what do? We just think about it, and we take it, and we learn day by day, what does it mean for each one of us? So I think that's how we want to take this conversation. Tomorrow, when we take a look at this, what are we actually dealing with? We're dealing with something that is monumental, 70 years, right, since the healthcare reform actually was transformed. And you have a decision before the court whether or not essentially the mandate that requires all of us to buy health insurance is actually constitutional, whether the federal government has actually overstepped its bounds. And there are a number of ways that this could go. They could overturn it completely. They could accept certain parts, reject certain parts, and they could accept the whole thing. And so this has huge implications and huge stakes. So I want to start off, first of all, with you, Ron, because you famously quoted the vice president when this was first passed, that this is a big effing deal. Tell us tomorrow just how big effing a deal it is.
I don't know if I was the original source of that, but certainly it was a, it was a dramatic statement. And can you hear now? The reality is we had 3 full-scale previous attempts under Harry Truman, Richard Nixon, and Bill Clinton to pass legislation that would approach universal coverage for Americans. All of them failed. Obama ultimately, through at great political cost and just enormous kind of massaging of the Rubik's Cube of all of the complex interests, was able to get this through. And he did so with a package that resembled nothing so much as the Republican alternative to Bill Clinton's plan in 1993. The individual mandate, which has become this ideological flashpoint, was first introduced as an idea on the national stage in the Bob Dole, John Chafee alternative to Bill and Hillary Clinton that was co-sponsored by almost 24 Republican senators, including Orrin Hatch and Chuck Grassley, and even Locke Faircloth. So it was not only the moderate Republicans.
I was in favor of it too at that point. I wrote columns, much to the First Lady's dismay.
As did Newt Gingrich. I mean, Newt Gingrich endorsed it as well. The idea went into remission for 10 years after that, disappeared, and then was resurfaced by a guy named Mitt Romney writing an op-ed piece in the Boston Globe in August 2004, who was the first person to seriously exhume that idea since the failure of the Clinton plan. And the history of this is that it is so arduous, it is so difficult, and I think the Obama experience really underscores, in terms of the aftermath, how difficult it is, that if the court substantially reverses this and undermines it, it will be a long time, I think, until you see another serious effort again. And the thing that has struck me about this is that we have debated this almost entirely at the level of theory and kind of broad ideological view about the role of government. There's the reality. I'll end on this point. Turn over to Joe. The reality underneath that is that there are 50 million Americans today without health insurance. The share of Americans who receive coverage through their employer has declined every year without fail since 2000. The best projections are that without this bill, we would move to 60 million uninsured by 2020. And by the way, so about 1 in 6 Americans are now uninsured. That includes kids who are now covered under CHIP and seniors who are covered under Medicare. If you look at the working age population, you're talking about almost 1 in 4. That's the trajectory we're on. And if this is substantially reversed, I think that it is going to be a long time till another president dives into these waters.
Joe, what is going to be the outcome if the individual mandate is struck down?
Well, first let me say more cosmically, I found myself today feeling anxious all day. And I'm just trying to work through this. Why am I anxious? The kids are okay, my wife's okay. You know, I got to close a column tomorrow, but I've been known to do that before. I'm anxious about this decision because I think it has a lot more, it has to do with a lot more than health care. It has to do with whether we can have a democracy without citizens. Whether we can have a democracy with presidents responding to their ideological base and appointing justices who are well off the charts of reason and who then go about destroying our democracy. It's nothing less than that. My immediate question is, well, if they strike down the individual mandate, as you were saying, Suzanne, does that mean that they're going to strike down Romneycare? Really? I mean, that's an individual mandate. I've been in favor of an individual mandate since before the Chafee bill. I had interesting conversations with the First Lady during that period, and the reason why I was for the individual mandate, and I told her, was that 30 years from now, when you and I are arguing policy on the porch of our nursing home, there won't be a single country in the world that has an employer mandate, because in a global economy, you can't saddle your employers with that burden. And ever since then, I've been looking for ways to get us away from employer-provided health care. The Wyden-Bennett bill was, I thought, a really good idea. Failing that, an individual mandate with exchanges, which are healthcare superstores. Really good idea. If this is overturned tomorrow, what is the Supreme Court saying? Is it saying that socialism is okay because we have Medicare and that's constitutional?
You know, you mentioned something that you wrote about recently. You said that Medicare and Social Security, if you find the individual mandate unconstitutional, why not find them unconstitutional as well? Can you explain that?
Well, I think that the reason why if they find the individual mandate unconstitutional, it's the utterly spurious and stupid broccoli argument that the Solicitor General of the United States couldn't find it in his great good wisdom to refute. The argument is, as Scalia put it, if we can force people to buy health insurance, why can't we force them to buy broccoli? The answer is, if Suzanne buys broccoli, it doesn't affect me one way or the other. But if Suzanne doesn't have health insurance and she drives her motorcycle into a tree and shows up at the hospital without health insurance, I pay for it. Completely different. Apples, freight trains, completely different.
Ron, do you agree? How do you see that? Do you think that's a valid case?
Well, I mean, one of the problems they've run into here is they wanted to structure this in a way that it could not be defined as a tax, right? Politically, they did not want it when they were doing it. When they were passing the bill, they did not want it to be a tax, and that's a difference between Social Security and Medicare, which are, you know, we're not, at least at the moment, the court is not questioning the federal government's ability to levy a tax. They're really talking about, you know, how far the interstate commerce clause can be stretched. But you know, part of the problem the administration has is they have never effectively made the argument about what this mandate is, and even thinking about it as a mandate in some ways is the wrong way. Is kind of it's a harsher way of thinking about it than the reality of what the program is. If you make $55,000 or less and you are uninsured, the federal government will pay 3/4 or more of the cost of you obtaining insurance for yourself or your family. So Yes. Do you have to contribute? Does the mandate require you to contribute toward your own insurance? Yes. But ultimately, what you're talking about here mostly is the collective provision that will allow you to obtain insurance. And like I said, I mean, in many ways, the biggest objections to the objections to this are clearly coming primarily from people who are insured and who have an ideological kind of complaint about it.
Yeah, let's talk a little bit about the perceptions of this, because I don't want to get too much in the weeds, but you've written before that the way the individual mandate is perceived and the way this law is perceived on the whole is that if you are white and uneducated, largely uneducated, don't have a college degree, that you are against this healthcare reform law. You believe that it is for minorities and folks who don't have any money. Explain to us, first of all, why this is seen in such a different way, and why is it not that the individual mandate, which was meant to broaden the field and allow more people to have health insurance, seen that way?
Right. So, as Joe knows, the political backstory in this is that there has been a kind of a group of Democrats for many years who have viewed universal health care, not from the political goal of it, not the policy goal, which is very real, as reversing what has been a growing alienation from Democrats and from government since the 1960s among big parts of the white electorate, especially the white working class, who since the 60s have increasingly concluded that the only thing government does is take money from me and give it to people who in their mind doesn't deserve it. And healthcare, in the Clinton era especially, was seen as a tangible way of reversing that. But that sale never got through. If you look at polling today, in only about a quarter, only about a quarter of whites, and only as little as 1/7 of working class whites without a college education, view healthcare reform as something that would benefit them and their family, even though the uninsurance rate among non-college working class whites is actually quite high. It's like 15, 16%, not as high as African Americans, which is 20, or Hispanics, which is 30, but higher than upper income whites. So, I mean, the problem that the political problem this was supposed to solve, it has compounded. And in fact, it has become, in the eyes of much of the white electorate, different among Hispanics and African Americans, this is seen as yet another primarily welfare program, even though certainly one of the premier goals of Rahm Emanuel and Obama when they were pushing it was to avoid
Joe,
that
is it really a messaging problem here, or is that oversimplifying this?
Look, I've just come off of a 3-week road trip. I do these every year. I went through battleground states this year, and I reached out especially to white working class and underclass folks. I got Charles Murray, who's going to be on the program later in the week, to give me some white, toppling out of the middle class zip codes, and we did some events there. And I can say to you that not only there, but across the board, nobody knows what's in this thing. I'll get small businessmen saying to me, I'm a small businessman and I'm against Obamacare because it's going to cost me everything. And I said, wait a second, hold on. Did you hear about the exchanges? And he said, what exchanges? Well, they're going to be like these healthcare superstores where individuals and small businesses can go and have the same market power as Time Warner has. And it'll lower your insurance rates for yourself, and if you want to give it to your workers, that's fine. But if not, the bill also provides health insurance for your workers. This is essentially, Ron put it in a kind of complex way, but if you're in the $20,000 to $30,000 range, you're essentially getting free health care. Now, the president hasn't made any of these arguments, not one of them. And I blame him for not doing that. It really is, it's a scandal.
So, Joe, let me ask you this, though. Is part of the problem as well is that you have this law that takes effect in various stages. So you cannot see, you cannot feel and realize what some of these things, the exchange programs that you're talking about, the mandate that goes into effect in 2014, that there are many things that have yet to be realized.
Why can't they? I mean, this is a president who can't even tell people when he gives them tax cuts. I mean, it's the most amazing thing I've ever seen.
But Joe, part of the problem is that the audience we're talking about is so inclined, so disinclined to believe that government will ever do anything that benefits them, that it's not clear. I mean, he did not make enough
With
of an
one
effort to
big
break through.
exception.
Yeah.
If-
Social Security and Medicare.
No,
Yeah.
there's another big exception, and I just noticed it over the last 3 weeks. If you are living in Ohio or Michigan, you have seen the government for the first time in your lifetime act quickly and effectively to save your job. The auto bailout. If Barack Obama is reelected president, it'll be because of the auto bailout.
You know, to your question though, there's an interesting, the historical precedent is interesting on your point. Social Security and Medicare had very different political histories. Medicare was passed in '65, went into effect in the summer of '66, and even though it was opposed almost as fiercely as health care, I mean, Ronald Reagan in the speech in '64 described it as kind of a step towards socialism, it was almost immediately off the table politically. It was not attacked by Republicans in the '66 elections, and Nixon essentially was silent on it. And by '68, it was beyond attack because it had gone into effect right away, and people were seeing benefits from it almost immediately. Social Security was very different. It was more like healthcare, where the implementation was spread out over a number of years. And in 1936, Alf Landon, 1 year after passage, actually did run on repeal of Social Security. Now, he won 2 states, so it didn't work very well, but there was still that same kind of opening. And I think it is clear that the staggered implementation, which was done in part to hold down the cost and to get those CBO estimates to work, has made the plan more vulnerable politically than it might have been otherwise.
These guys just think too hard about presentation. They really do. They run all of this strategy and make what should have been a difficult but comprehensible thing totally incomprehensible. And then even on moral issues like gay marriage, they have to stage it. You don't stage your position on a moral issue. You don't stage your position on letting children of immigrants into the country. You don't wait 3 years to do that. You know, I think the president's a very smart and decent man, but I've never seen anything like this in terms of his fear of presenting clear ideas to the American people when the other side is presenting utter distortions to the American people.
Joe, does the president survive if his health care plan does not? Does he get another chance,
Well, listen,
another 4 years? What do you think?
I think that the simple answer is usually the best one in this country, and if it's found that he has done something unconstitutional, there are an awful lot of people who aren't going to see beyond that. He's also running against one of the least popular, and I talked to hundreds of people over the last 3 weeks in North Carolina, Virginia, Ohio, Pennsylvania, and Michigan, and not one of them said, "Wow, Mitt Romney is such a great candidate for president. I really love the guy." So, I mean, he has some room for error here, but it's disappointing to me that at a moment when citizenship is really important for the first time in a while, when the country really, where we really have to make some big decisions, this guy, who is so eloquent, can't seem to understand how you may mount a campaign to explain what you've done.
Ron, do you agree with that? Because I want to bring up the other point that we had talked about, which was the 9 justices, and the fact that of those justices, the 5 conservatives, pretty much all along the line, against the health care plan, and the liberal justices appointed on Democratic presidents all for it. And so there's definitely a question of credibility within the court itself. So what is it about? Is it more about the credibility of the court? Is it about the effectiveness of the administration?
Well, I think, first, this is what's rare and almost unique about this court now is that the ideological divide and the partisan divide completely overlap. All 5 conservatives were appointed by Republican justices, all 4 liberals by Democratic justices. We have the prospect of 5 Republican-appointed justices outvoting 4 Democratic-appointed justices to overturn the biggest Democratic legislative accomplishment in 45 years since Medicare. So in that sense, politically, I'm not sure this has a huge impact on the election. I think it does provide ammunition for Republicans who want to argue that Obama is taking us on a sleigh ride to Sweden, and he's, kind of turning us into kind of a soft European socialist state. But it also does, I think, energize the Democratic base. In some ways, the more important question for Obama, if he wins, is what, assuming that they do not knock down the whole bill, if they just pull out the individual mandate, can he sustain health care without it? Remember, Barack Obama in 2008 ran against the individual mandate. He did not have it in his plan. Hillary Clinton had it. She adopted it from Romney Schwarzenegger with the two before her who had talked about it. And Obama argued this could be done without it.
But wasn't that part of the mistake, though? Because in some ways, some people say he wasn't bold enough, he didn't do enough, that it is piecemeal, and, there's two compromise.
The irony of this is this. My sense is, what Ron just said about the individual mandate is absolutely true. And my sense is, ironically, if Hillary had been elected president, she wouldn't have tried to do this, because she had been through it. Obama, who wasn't for the individual mandate, tried to force it through because he was inexperienced and he was going for history. Hillary Clinton, who knew some history, would have focused on the economy.
But let's think about this for a minute. Let's think about, okay, that may be true, but like within the context of healthcare, the reason the individual...
By the way, this thing can be upheld tomorrow, too, I just want to say.
Right, and we should talk
Do you
about...
think it will be?
We should talk about that.
Well, what are the odds here? Let's put some odds on this.
I don't know who's going to win the election. How could I know what nine secretive,
So
You're not going to make any. You're not
justices
going to make any guesses for it. You're not
I
going to
stopped
make
making
any wagers.
I stopped making predictions a long time ago.
when it comes to like forecasting the Supreme Court, the immortal advice of William Goldman about Hollywood applies. Nobody knows anything. The first rule of Hollywood. But there were two different kind of strands of thought in Washington originally, and now there are like two in each case bookended. The original strands of thought were many of the legal reporters, as you know, looking at William Kennedy's precedents, thought that ultimately he would vote to uphold the mandate and it would win on a 5-4 basis. At that point, you had the political reporters who said, no, if you look at Anthony Kennedy's, Justice William, the novelist, Anthony Kennedy's, on the big decisions, he always finds a way to side with the Republicans, and therefore he will vote to overturn it, and that will be a 5-4 decision. What's interesting this week is the new kind of uninformed chatter is around a different set of bookends. One, and focusing on the Chief Justice, John Roberts. One says the fact that Roberts sided with by and large, a more liberal decision on immigration was trying to give him the room to go right on health care and not be accused of being a mindless
Joe is just nodding his head. Joe, you got to jump in here.
And then the other half
There's a reason why I don't live in Washington.
Right. And then the other half says that the fact that Roberts is writing, and I had someone just today, a prominent lawyer who's here at the conference, say that the fact that Roberts is writing the decision, it seems to be writing the decision, is a sign that it's going to be upheld, that he, after famously presenting himself as the umpire in his confirmation hearing, would not want to be the author of a 5-4 decision of the kind we're talking about.
I had an opportunity recently, it was about 4 weeks ago, through the Aspen Institute at the Supreme Court to interview Justice Ginsburg, and she wouldn't give us, anything on the health care reform, obviously, but she did explain certain frustration that she feels with the partisanship that's in Washington, and that she did feel that the court in some ways is one of the few places where you can actually try to get beyond the partisanship, but that it was very difficult. I want to turn the corner a little bit and, Joe, have you discuss something. This was really, if you haven't read it, you really should read this. It was very moving. It's about Joe's parents. It's called The Long Goodbye, and it's a beautifully written article about his journey and both of his parents who suffered dementia and who died, and some of the lessons that you learned, Joe, from that experience. And I wonder if you could share just a little bit about that with the audience.
Well, thanks. Ultimately, we can talk about health care in theory till the cows come home, but for an awful lot of us of a certain age, we're having to deal with health care in reality. And the reality is that our parents, the World War II generation, are passing away. And I was a death panel for 6 months. My parents met on the first day of kindergarten at PS 114 in Rockaway Beach, Queens. And they were together more or less for 86 years. And I had two maiden aunts who came along with the bargain, and at a certain point, they all moved. It was kind of like a miniature shtetl to State College, Pennsylvania. And as they got older, my dad got a lot more ornery. My mom got kind of whiffy. As she moved into dementia, she lived in a world of, at one point I called her up and I said, "What's going on?" And she said, "Well, I have this really wonderful new lover. He's right in bed next to me. We've made love 3 times. I said, "Where's Dad?" And she said, "Oh, he's in the next room." And it was just, but as peacefully as she went, and as, you know, in her lovely fantasy world that she went, Dad went the other way, and he, you know, raged against the darkness of the night. I had to take away his driver's license. He continued to drive. I had to take away the keys to his car. I had to get them 24/7 home health care. But ultimately, I was dealing with the fee-for-service Medicare system, which is a very confusing and chaotic system. They had an internist, a family doctor, but he couldn't stand up to my dad. And they had this whole platoon of specialists, all of whom were, none of whom were in communication with each other, and they were all prescribing this or that or the other thing. And my dad had to deliver the pills to my mom and to himself, and he sometimes forgot and sometimes made unilateral decisions that she didn't need that pill anymore for some reason or other. It was complete chaos. And finally, my mom wound up in the hospital last October, and I was on the road, as always, and a decision was made. I had to make a decision whether or not to put a feeding tube in her. The doctor said, "We're going to lose her if you don't." And so I knew that she didn't want it. She just wanted to die. She said, "I don't want to be a vegetable." But I didn't want to make that decision with my brother in Asia and myself in Iowa. And so I had them put the feeding tube in. And then after that, I made another big decision. I lied to my father and said, "Mom has to go into a nursing home and you want to be with her, right?" And he did, but he kept on forgetting the right. And when we got him into the nursing home, he started the Occupy the Elevator movement because he kept on wanting to leave. But what happened was this. In the nursing home, the doctors and nurses that they used came out of a system called Geisinger, which is like the Mayo Clinic, in that the doctors are paid according to salary plus performance bonuses, rather than fee-for-service, rather than for the services that they perform. And so 3 things happened immediately that were really important. One is they stopped sticking needles in my parents, because they knew that both my parents were in the last months of their lives. Number 2, they stopped them going to specialists. You know, several of the specialists were almost embarrassed. The urologist said to me, "Your dad has prostate cancer, but he's never going to live for that to make much of a difference." So they stopped them going to specialists. And the third thing they did was they started talking to me as if I were a sentient human being. And they made me part of the team. They told me every time they wanted to change the medications. By the way, there was only one person who was doing this. And, you know, as things evolved, they helped me to make the difficult decisions. It's not easy to be a death panel. I had to decide in both cases to turn the switch on my mom, who wasn't eating even, you know, after the feeding tube was put in. That was artificially keeping her alive. My dad had pretty bad kidney failure. The lesson here is that there is an answer for our entire budget crisis, much of which is centered around Medicare. In fact, there's an answer for almost all of our big problems if we only would stop screaming at each other. What Geisinger found was this. I mean, can we afford to be healthy? Geisinger, I'll just tell this and then we'll move on. Geisinger has spent a lot of time recording procedures in electronic records. they now have about 15 years worth of records so that they know what works for most big diseases. They actually give you a lifetime guarantee for their heart surgery. They have 9, they do. That if you have to come back in, if you have to come in for another bypass operation, they'll give it to you for free.
Not buy one, get one free.
No. But they have, there are 9 procedures that they use for chronic diabetics. For chronic elderly, they also came up with a package, a bundle they call it, of procedures. And one thing they did was to add in a layer of bureaucracy, a personal case manager for each of the elderly people. And that's a nurse, and sometimes she goes to their house, and sometimes she just calls them up. They have procedures that they have to go through every day. They get Bluetooth scales where they step on the scale and their weight and their body fat is sent to the Geisinger computers. And if those of you who have been through this understand that one of the things that elderly people most want to do at this stage is talk about what's wrong with them. And that, the ability to talk about it, to share, takes an awful lot of the pressure off of doctors. And they've studied this now, and they showed that that this system of taking care of the elderly reduced hospital visits by 18%. It reduces revisits after surgical procedures by 36%, and it reduces costs by 7%, even though they've added in this extra layer of bureaucracy. So,
But,
go.
I mean, on the list of things that people don't know about the health care bill, and which interestingly will not, unless somehow they go to throwing out the whole thing, will not be affected by the Supreme Court, and which also, incidentally, was, during the process, Obama's personal, I believe, top priority in all of this, was that the bill contains a myriad of mostly small pilot projects designed to encourage the mass adoption of the kind of integrated systems that Geisinger or Cleveland Clinic uses. I mean, there's a whole series of things in the bill providing financial incentives to hospitals and physicians to shift the payment system from volume to value or from input to output to the results for patients. And you know, that, in some ways, the core debate, because I think both parties do agree that Medicare is the crux of the long-term financial challenge, is what you have are Democrats arguing that the way to gain control of long-term health care costs is to change the incentives for providers through all the kinds of things we're talking about. And Republicans arguing that the key is to change the incentive for patients and to have patients be more exposed to the cost. That's at the core of the Ryan plan on Medicare. That's at the core of the whole consumer-directed health care. So there really is, in the health care bill, on the list of people that don't know, it really is designed to encourage the entire system, especially starting with Medicare, to move in the direction that Joe's describing. But that has almost been completely eclipsed because we are debating just this one ideological point.
So looking forward,
is
is there a point in which the Republicans and Democrats can come up with a plan, even if this is thrown out, that will work
we have to make
direction?
a major decision here. We have to make a decision about whether healthcare is a free market or it isn't. I mean, you know, the Republicans keep on arguing that market discipline are going to lower the prices. And that might be true if you have a national health exchange, a national massive healthcare thrift store, where patients get a lot of different choices. The way the current bill works in states like Alabama, there's only Blue Cross Blue Shield. Yeah. There aren't any choices. And what we've tried with Medicare has been to give Medicare Advantage as an attempt to build in market principles, and it costs more. So I think that, and also the final point I'd make is that at a certain point, it becomes utterly cruel to ask people like my parents to make informed choices, market choices about health care. So, I mean, I think that the ultimate way that you're going to go is, if this thing is upheld, which I certainly hope it is, you know, you extend Medicare out to the age of 80, you extend Obamacare out to the age of 80, and then Medicare kicks in with a program that is with salaried physicians.
You know, in terms of finding the common ground, think about it. It's an interesting way to think about it. What Republicans under Paul Ryan are now proposing is that everyone over 65 be given a subsidy sent into exchanges to choose among a variety of healthcare plans, one of which would be a public option, conventional Medicare. And now, and what Democrats have, what Obama's healthcare proposal have put into place is for everybody under 65 to be given public subsidies and sent into exchanges, and originally with a public option, now without it. Republicans want to eliminate the subsidy exchange public option model for people under 65 and impose it on people over 65. Democrats oppose creating it for people over 65 and want to create it for people under 65. So in a more rational political world, you could imagine somewhere down the road where you say, essentially, we would apply this model to everybody. Everybody would get some subsidy and be sent into exchanges to choose among a variety of plans, one of which would be a Medicare-like public option. But getting to that, you know,
Could I just say, though, I want to make a larger point. Ron and I have been working this area for a long time. And to me, there was a kind of golden age in the early 90s when the Republican Party was the source of a great many terrific ideas. Individual mandate was one of them. Cap and trade was another, which George H.W. Bush imposed on sodium dioxide. Welfare reform was another. School choice was another. I was in favor of all these things. If you asked me at that point whether I was a Democrat or a Republican, I would just say I'm a kind of moderate, but I'm really admiring the new thinking that's coming out of the empowerment wing of the Republican Party. What we've had in recent years is an ideological cataclysm that has destroyed that Republican Party. We now have a Democratic Party that is almost totally on the defensive all the time, and we have a Rush Limbaugh Party. And I think that this has done real damage to our democracy. I would love to have the Republican Party that would think of creative ways to use market principles to bring social services to the people back, because we really need that.
I'd like to open up the floor for any comments or questions. I heard a couple of in the audience, so if you want to go ahead and challenge some of the comments.
Limbaugh, or the idea that the Republican Party is enthralled?
Do we have a microphone here, this gentleman?
Thank you, Joe. Thank you, Joe. First of all, anybody that hasn't read your Newsweek article. Is it
Time.
Newsweek? Time article. Apologize. Your Time article needs to. It was terrific. I laughed. I cried. It was thought-provoking. Anybody with aging parents should read it, and anybody who's aging should read it. But what I was struck by was, first of all, I wanted to find it's Geisinger, right? Geisinger Institute in Florida. Why isn't it more broad-based around the country, number one? And the second thing I wanted to ask you was, look, I think it's a great concept. But the second thing I thought about was, if I showed the article to my mother, the Time article to my mother, she would have not approved of going to a Geisinger Institute. And the only way I think that you could do it nationally is to mandate it. Mandate that kind of system. I think you pointed that out earlier, that you would have to mandate a system that everybody goes into a Geisinger type of institute. I'm not necessarily against that, but there are a lot of people that would be against it. So how do you rationalize that, and how do you make it more available to people that might want to opt in and not opt into typical fee-for-service? Sorry about Newsweek versus Time.
Well, those are all good points, and the fact is that doctors are going to be enormously resistant to doing away with fee-for-service because it makes them the captain of their ship. They get to make all of the decisions all the time based on their instincts, which are often good, but often because of malpractice, they'll order the extra X-ray. By the way, we really have to deal with malpractice as well. The reason why your mom would be sold on it, on Geisinger, and the thing that they do differently was the thing that I experienced. They make you part of the process. They actually have this orientation course for doctors, which is laughingly called Patients 101, where they teach them to do things like look your patient in the eye, or the family. Shake their hand. Introduce yourself. Hi, I'm Dr. Klein. I'm the oncologist here. That means I'm in charge of the cancer part of the program. And it takes effort. But once you become a co-conspirator, I mean, the head of Geisinger's mom just died. He's Dr. Glenn Steele. He's a brilliant guy. He was the head of this School of Medicine at the University of Chicago before he did this because he thought this was a really interesting experiment to do. And his mom was dying, and at one point they had like 6 different doctors around her bedside, and she looked up and she said, "Why aren't any of these people talking to me?" And we've gotten into a real rut with fee-for-service, an expensive rut. As I said in the piece, when my mom was 80, she had had a heart murmur since birth. And she said, "It's getting worse." And I said, "Why is it getting worse?" She said, "Well, I don't have the energy I used to have." And I said, "Mom, you're 80. And she said, "No, I know it's getting worse, and Medicare paid for a heart valve operation for her that cost $100,000. And, you know, if Dad wanted to pay for that, fine. But to make bus drivers and file clerks and convenience store cash register bangers pay for that, I think is obscene." And by the way, it took her 3 years to recover, and then she had just as little energy as she did before the operation. We have to get rid of this system.
And by the way, there are 40 million seniors today, and the estimate is that by 2040 there'll be 80 million. So, you know, the kind of choices that that we're facing today obviously get magnified, and it becomes more and more difficult to ask that bus driver because there are fewer of them relative to the people in retirement.
Can we get another question? Yes, please.
Got some back there, too.
I'm a physician, and I actually agree with Joe Klein
Great.
about a lot of things. But
We'll pay you really well.
the comment I have and the question is, it's interesting when you sit around a doctor's lunchroom, most of the doctors say, "I hate Obama, I hate Obamacare, but yet I can't wait to get on Medicare. And when I get 65, that's the insurance I want." So it's kind of there's that dichotomy right there. The second thing is, or the question is, couldn't they have sold this as Medicare is government health insurance? It's not government takeover of Medicare. It's simple insurance. Up until now, it's fee-for-service insurance. So essentially, you go to any doctor you want, and the government pays the bills instead of Aetna or United or Humana or any other insurance company. It was never sold that way as to push for single payer, which is obviously, that's gone at this point.
Well, I mean, first of all, I mean, it is that. There are roughly, the estimates are that it would cover about 33 million people, about half of them through the subsidies for the exchanges, which essentially is going out and buying Aetna or United or whoever. The other half would be through Medicaid, and that's where I think the physicians really get nervous because of how low the reimbursement rates are through Medicaid. But look, this was the first time that the AMA supported, even nominally, the health insurance, health reform, and that was a big reason why it passed. It has been very, if you look, it's interesting, if you look at the Gallup and other polling on each time, Clinton, Truman, Obama, they can be overlaid on each other. They're incredibly similar. It is very difficult to ultimately win the argument. I mean, Americans are dissatisfied with their health care, but it's very easy for the opponents to say the devil you know is safer than the devil you don't know. So, I'm not as sympathetic to the arguments that they didn't make the right case or they kind of sold it wrong. I think they did about as well as they could. They tried to structure it in a way that would convince people with insurance that they would benefit from it, and they simply were not able to win that argument. And the biggest flaw, I think, was not putting it in place faster where people could see tangible benefits, because even in the White House at the time, as you know, they felt the only way to ultimately win this argument was in practice when people would feel some direct benefit from it.
Absolutely.
I have a question. Ron, you may know the answer to this, but we have a real working model of how this would work, the Federal Employees Health Benefits Plan. And I thought that the idea would have been, that's a national exchange, actually. Why couldn't we have just made that the plan, where people federal employees, like including Congress people, by the way, get vouchers to buy health insurance, and they have a range of choices. Why, Ron, do you know why they didn't do that?
Do you know?
Well, I mean, I'm not really sure what exactly it means to do that, in the sense that, the model is fundamentally the same of giving people, a check and letting them go into exchanges. The exchanges would be statewide or regional, and, rather than, I mean, I honestly, I just don't know how that would work. If you live in Washington State or Idaho, how you would buy into the FEHBP, whether the insurance companies that provide that health care would be operating in Idaho.
I want to try to get as many questions in here. We're going to go to the woman in the back, and then we'll go to you next. Yes.
In the hearings in the court spent much time talking about the relationship to this relative to the Interstate Commerce Commission and how it related Interstate Commerce Clause.
We know what
and
you
how
mean.
it related back to the passage of Social Security. And we haven't, or you haven't really addressed any of that. But the court, in the hearings, really spent a lot of time on
Do you
those
want to
issues.
address that quickly?
No, we did. I think we did talk about that before. Right, but that has become the core issue about whether the Interstate Commerce Clause can be stretched to require someone to purchase a product. Although again, I mean, this is not simply a question of asking people to take $1 out of their, $1 out of their pocket. You're basically saying if you put in 20 cents or a quarter, we'll give you 75 cents toward your health care. But that is going to be the issue, and in many ways, the political failure was allowing this to become framed simply as an ideological choice about how far the federal government can reach, I think, as opposed to it being more of a practical solution to a problem that will exist the day after the decision. There are 50 million Americans today without health insurance, and those numbers are inexorably rising as we go through the cycle of rising costs and declining access. And that is almost completely vanished from this debate. We are kind of, focused on really this fundamentally ideological, it's a legal question, but at its core, an ideological question.
Yeah, I'm a physician also, so let me give you my perspective. Wyden-Bennett had at its core institution of the Federal Employee Health Benefit Plan. The critical thing with Wyden-Bennett, which should have been adopted by them because they had it right there, all they had to do is say, here's health care reform, now let's deal with the real issue, which is the economy. They didn't want to do that. But the notion of the mandate, people can opt out of the mandate. Employers opt out. They pay their penalty, and then no one's going to have health insurance. As you pointed out, fewer and fewer people are getting health insurance through their employers. You've got to eliminate the preference that employees get for their health insurance.
that's a good point.
Absolutely. The second thing is the government needs to step in and stick a Kaiser and a Mayo and a guy. I'm from California, and Kaiser works every bit as good as Geisinger or better. Has a huge database that makes Geisinger's look like nothing. You've got to have the government say, we're going to stick an integrated model in every single community as a choice. You then create a value-added tax. You take a percentage of that. I know Republicans hate this, but you take a percentage and you say, this is health care benefits. This is what you're paying for. And so everyone pays taxes, and we don't know what the hell we get for our taxes. We get wars. We get a bunch of crap we don't like. But if everyone's getting health care, they get a basic plan. And then, if they want to step up and buy a supplemental plan, they pay for a supplemental plan out of their own pocket. They don't get a tax break for that. There's your health care reform. It's not that complicated. As you've pointed out, physicians who are salaried have no incentive to turn up the volume. And if you look at Kaiser, and the problem with Kaiser up at Palo Alto at Stanford, where we have Kaiser up there, Kaiser just sets their premiums now just right below the Palo Alto Clinic or PPOs or whatever it is. But if Mayo's competing against Kaiser's competing against Geisinger in the same model, then you start getting real efficiencies. And unless the government says, we're doing this, period. Because the whole, Obama says, my mother was on Kaiser in her last years. They know these models work.
Thank
I'm
you.
going to shut up because I can go on forever.
Go ahead. I know this gentleman right here has a point, and then we'll bring it to that.
Sure, thank you.
young
My
woman in
name is
the
Jeff
back.
Binder. I wanted to ask the panel to talk a little bit about tort reform and the bandwagoning and scapegoating that goes around it. of the $2.8 trillion in healthcare costs that we had in 2011, about 1/5 of 1% went to Medicare premiums. I'm sorry, Medicare, malpractice premiums. So it's a really small issue generally, and no one talks about the accountability that comes with the legal system for doctors that do perform procedures that aren't necessarily up to the standard that we expect as patients, and whether or not we should be focused more on some of these other issues than tort reform.
No, we shouldn't, by the way, because the real core cost of malpractice is not in the premiums that are paid, but in all of these services that are rendered because doctors are afraid that they're going to get sued. And if you took that out, you'd save some money. And by the way, the president took leadership in this. He said he was willing to make that deal. I think it's a really good deal. But the fact is that whenever the president says he's willing to make any deal, what he gets back from the Republicans are the sounds of silence.
And the inability or the failure to address tort reform in the healthcare bill was, I think, as Joe is getting at, just the classic example of why this intensely polarized system does not work. If there were Republicans, if there were 5 or 6 Republican senators willing to vote for health care reform, I agree. There's no question that Obama would have included a significant tort reform, acknowledging that it is a small part relatively of the overall problem, but still a part, that he would have included a significant plan in there. But if no Republicans would come over and vote for it, even with tort reform in it, and all that including tort reform would do would be to splinter the Democrats when you need every single one to vote for it, he couldn't make it part of the package. And it just shows how difficult it is to craft truly balanced solutions to national problems when one party has to provide all of the votes in this quasi-parliamentary system that we're now living in.
The young woman in the back, please.
Thank you for calling me a young woman. So I want to go back to the title of this, which is Can We Afford to Be Healthy? And I've enjoyed listening to the conversation, but I think it's more about can we afford to be sick? And, you know, I would like us to, not in the time that we have here, but just urge you to broaden the lens. When we catastrophize about the aging population, we don't necessarily have to go into our elder years with the same panoply of health conditions that the current generation does. And we need to be focusing upstream on being healthy and not just downstream on being sick.
It's a very good point. Is there somebody else who would like? Yes, sir.
I'm an 87-year-old still practicing surgeon. And I can tell you I have seen it all, and I appreciate all the words of wisdom that our panelists have given us. Everett Koop said, you know, the American public, they want 3 things out of the medical profession. They want the best medical care, they want it cheap, and they don't want to wait for it. First question is, can you comment on whether or not and how long we're going to have to wait to get treated? And the second point I would make is that a baby girl born today, an infant born today, half will live to be 100. Right now we have an incredible number of centenarians. And I would ask you, what are we going to do? What preparations for the future are we going to make in terms of the fact that every year life expectancy is added every 2 or 3 years? Thank you.
Take that?
Well, I think that, you know, you're implying that rationing is going to be involved, and I think that if you go with the best practices model that Kaiser Permanente, Geisinger, and others, and by the way, why the hell aren't they sharing their databases here? They should be. You're going to find a system that gives people the health care that they actually need, rather than all of these other procedures that they're getting that they don't need. And so I don't think rationing will be a problem because there'll be fewer procedures being done.
You know, one theory is, actually a theory, Herb Stein's great axiom was, any trend that can't be sustained won't be, right? Won't. And so in some ways, the demographic pressure that you're describing should, over time, make more likely the world that Joe has described in his article, because simply there is no other choice. I mean, one thing that's really striking about healthcare, and one aspect of it that doesn't get discussed enough, it is I've covered Washington, Joe longer than me, but I've covered Washington since the early 1980s, and it is one of the only pieces of legislation I've ever seen that consciously attempts to transfer resources down the generational ladder. It slows the growth of spending in Medicare by $500 billion over the next decade, and uses that money to expand access to health care for the working age population. And the reaction to it has been a severe movement toward Republicans among white seniors. 58% of white seniors voted Republican in 08, 63% in the midterm election in 2010. Over time, there is no choice but to shift the kind of balance, to rebalance the way we make our public investments from the retiring population, which is, as I said, going to double in size, toward the working age and the young population. And it gets even more complicated because our senior population today is 80% white. We had no immigration between 1924 and 1965, and it's only slowly going to decline. Our under 18 population is 47% non-white. It's going to be majority non-white by the end of this decade. So at some point, we are already facing, although it's not explicit in our politics, this kind of generational battle for resources that ultimately is going to have to be rebalanced in some way because of what you described. It's just unsustainable not to. But it is going to be a very stark kind of clash with sharp generational and racial tinges unless we find a way to understand that we're all in this together. And unless we move more of these young kids into the middle class, there's going to be no one there to pay the payroll taxes to support Medicare and Social Security for the retiring baby boom.
That's, Ron has just identified and he did it at the beginning of this as well. And it's something that I see all the time when I'm out in the country. But we've lost track of each other, and people don't trust each other. And you go to Tea Party meetings and they see a country they don't understand. They see a country where all of a sudden all the people working in owning gas stations are South Asians. Where on earth did they come from? And there are all these Mexicans around. They don't even want to learn English. And my grandson just became gay, and my granddaughter's dating some Chinese guy, and the President of the United States doesn't have the good sense to be black or white. And his middle name is Hussein. And I think that the resistance that you're seeing to any sort of program like this, even when it's in their best interest, is because of this tremendous fear they have of the enormous changes that are going on. And I neglected to mention the fact that all of these manufacturing jobs have gone elsewhere, and it takes 2 salaries now to run, to have a family, and people are scared to death of what their kids are doing in the afternoons, which is, by the way, why they join churches.
Joe, Ron, thank you very much. I appreciate it. I know we are out of time. I wish we could take more questions, but I am told that we've just run out of time. It is going to be an immensely important decision tomorrow. We're all going to be watching it. If you get a chance, we would love to hear your opinions. We have a CNN Express bus, so come by, share your insights with us, and perhaps we'll even get you on camera as well. Thank you very much. Appreciate it.